Right, so I'll be using this mic, mostly standing here. Hi everyone, nice to see you. I've really enjoyed all the talks today and it's a pleasure to be here. So just very briefly about me. I'm an ethicist, as Ibrahim said, in the Assuring Autonomy International Programme. I joined from the Department of Philosophy, where I did my PhD on moral responsibility, AI and autonomous systems. I'm not a clinician, I'm not a software engineer, I'm not a safety assurance person, but it's my pleasure to work with brilliant people in all of those areas, and the research that I do is very deeply interdisciplinary, so that's what I'll be talking to you about today. So from beyond safety assurance. As you probably know, the University of York is a big player in safety assurance and has been for some time. As I said, I am part of the Assuring Autonomy International Programme, this £12 million partnership between the Lloyd's Register Foundation and the University of York. The work that the programme does is partly academic and theoretical and partly very applied and empirical. And one of the things that we do is provide free expert advice on safety assurance. Moving forward. So what's safety assurance? As you've seen from the presentations today, there are a lot of different approaches to it, but one important way of assuring safety is through an argument-based approach, and that's very much the school of thought that the University of York comes from. So that's rather than following a prescribed set of rules or steps to achieve justified confidence that a particular system will be safe, it's about constructing a valid argument that supports confidence, or in philosophy speak, justified belief that a system is safe. The University of York in the 1990s developed something called the goal structuring notation. This is a format for the graphic documentation of safety cases to show that safety goals have been achieved. And it's the standard notation for safety cases in a range of industries, including nuclear power, defense, and traffic management. Shakir's presentation used this notation, and I'll be using it a bit later. And these here are the essential elements or the essential components which build and communicate the safety argument. I won't go through all of them now, but when I talk about the particular argument pattern that we've constructed, I'll pick out some of these elements in more detail. So why are safety cases or assurance cases a good thing? There are lots of reasons why they're a good thing, but just to pick out a few. They provoke structured thinking. It's a way of organising thinking to create this argument and communicate this argument about a particular property of interest. They enable multidisciplinary communication. You can integrate lots of different evidence sources. And I always see it, and I see it increasingly in the work that I'm doing, which I'll get onto in a little bit, I see them as an exercise in real honesty, because they're about making things that are often implicit assumptions truly explicit in order that they can be critiqued and reviewed. So the work that we're doing, or that I'm doing with Ibrahim and with our colleague John McDermott, is to think about how we can extend this methodology to look at a much broader range of system properties, a much broader range of ethical properties beyond safety. So what is an ethical assurance case? Well, if the safety assurance case is about achieving justified confidence that a system will be acceptably safe when used in its intended context, this is about achieving justified confidence that a system will be ethically acceptable when used in the intended context. And what I mean by ethically acceptable, I'll describe in a few slides. So why would anybody want to do an ethical assurance case? Sorry, just multiple screens. Ethics is important, right? There are lots of reasons why ethics is important. And looking specifically in the healthcare context, AI and autonomous systems do have the potential to transform healthcare. They can offer earlier, more accurate diagnoses, provide novel insights, enable faster and more efficient service delivery. But if it's not ethical, if, for example, it shows bias against particular groups, or doesn't allow for patient values and preferences to be included in clinical decision-making, or if it doesn't really allow for clinicians to exercise their professional skills and autonomy, then it won't be positively transformative. We'll be replacing one set of problems with another. So that's one reason why ethics in general is important, and why ethical assurance cases are important. This is more generally about why ethics is important, and the next two slides are why ethical assurance cases are important. They're also important, this approach is also important for clinicians to ensure that they're not overstretched, carrying heavy burdens of stress and worry. So if it's going to be positively transformative, it's going to help clinicians, but these benefits won't be harnessed if the systems aren't ethical when used. Now, many people here are positive about AI, but as I understand it from colleagues working in healthcare, there are a lot of people who are worried that AI is going to take their jobs. So another reason why ethical assurance cases are important is because they can help keep a spotlight on these issues. We're interested in a range of stakeholders and the impact of this technology on a lot of people who are either using it or on the receiving end of it. So we can keep a spotlight on the needs of these people. And of course for patients. So AI has many benefits, as I just said, which can improve patient care and outcomes. But we also need to ensure it's sufficiently ethical and well integrated, and that the possible negative consequences have been thought through. So why ethical assurance cases? So this is more about why we think the assurance case approach is particularly promising. So this over here is an infographic which takes a number of the ethical principles for AI that have been published recently, and it shows, these blobs show the different things that have been highlighted as important. Now, there are lots of different ways of carving up the space of what people have thought is important about the ethics of AI and autonomous systems, but I tend to carve it up into these three categories. So there's a set of concerns about data ethics, about privacy, about opacity, about bias and discrimination. There's another set of concerns about the increasing autonomy of systems and the impact that that has on the autonomy of humans, on human agency and control. And there's a third set of problems about the distribution of the benefits and burdens of this technology. So those are the three core areas. Now, that's a huge amount to try and address. And often specific things are addressed, like fairness or privacy, and those are important. But one of the advantages of the approach that I'm about to tell you about is that it manages to structure and encompass quite a lot of these things in a single argument. Why else is ethical? Why else? This is the final why. Well, because ethics is actually quite difficult to do. There's no single right answer to many ethical questions. Now, by this, I don't mean that ethics is subjective. People often say that ethics is subjective, and that's not what I mean here. In philosophy, subjectivism means that our moral judgments are expressions of our emotions or our particular attitudes, and I think there may be an element of emotion in ethics, but it also involves reason. And if it was just about people's attitudes and emotions, then no one would ever be right or wrong, morally speaking. So you wouldn't be able to say things like torture, cruelty, forced mutilation, all sorts of things that we do instinctively want to say are right or wrong. We wouldn't be able to say they're right or wrong if we say that ethics is subjective. So that's not what I mean here. But what I do mean here is that there's often more than one defensible or justifiable way to address a problem or to do the right thing. It's a matter of interpretation and debate often. And over time, our views can change. And it's also context specific. Another reason why ethics is difficult is because it often involves trade-offs that can be difficult to understand, well, not difficult to understand the trade-off, but difficult to know how to reconcile them. So someone mentioned the trade-off between performance and fairness. There's often, in this context, a trade-off between performance and explainability. These can be very difficult to reconcile. And not only that, but the values involved in these trade-offs can sometimes be incommensurable, which means that they can't be evaluated by a single metric. You can't say privacy is worth this number and fairness is worth this number and evaluate them on a common scale. So you need to find more nuanced ways to weigh these things if you want to do justice to the truth of these ethical problems. Okay, so what's the how of ethical assurance cases? So as I said, it's about taking this safety assurance methodology, particularly using the goal structuring notation, which actually this particular one isn't, but it's a simple version, to assure ethical properties beyond safety. And in particular, what I'll be doing is presenting an argument pattern for not one specific ethical property, but for the ethical acceptability of a system as a whole when used in its intended context. And it's about using a graphical notation to present the argument. So this is actually an emerging approach in the landscape. It's only really been around for a couple of years, and a paper written by the Turing Institute, the Alan Turing Institute, which was just published this month, is perhaps the most sustained defense of this approach. But we're the first to really try and present a clear argument about it. So different approaches are, and this is the Fraunhofer approach that I've seen, is assure a single ethical property, whereas we're looking at a suite of ethical properties in one single argument. The Alan Turing approach is to take this bottom-up participatory design approach so that the argument itself is designed through focus groups and talking to the people who are immediately affected by the system. And while we think that those sorts of activities are really, really important, our approach is more top-down, to take certain principles and structure the argument ourselves, and then use that participatory approach to actually instantiate and not invalidate, hopefully not, validate individual assurance cases. So back to the infographic, and this is how we're starting to do things. So more than 80 major sets of ethical principles and ethics declarations were published in the last few years. Virtually any organisation that had a connection to technology policy produced one. From a range of different organisations, government, public bodies, NGOs, corporations, universities, you name it, someone's got one. But some research has been done that actually all of those can be distilled into the 4 biomedical ethics principles, which I'm sure many of you here will be familiar with. So actually a lot of the concerns and the different principles that have been mentioned can be distilled into these 4. This isn't necessarily what everybody thinks, but we've taken this as a starting point for our argument. Now, I'm sure a lot of you don't need me to explain to you what these 4 principles mean, but just for those who aren't well-versed in biomedical ethics, the first one is non-maleficence, do no unnecessary or unjustified harm. That's the core principle for clinicians. That's the first among equals, as it were. The second is beneficence, which is to actually positively advance the welfare of people. The third is respect for personal autonomy. So that's people's capacity to live according to their own reasons and motives and to be rational agents and think for themselves. And that's where questions around informed consent often come in. And the third is about justice, making sure that the distribution of benefit and risk is fair and equitable. And this now is the argument pattern for our ethical assurance argument. This shows the logical flow of the argument. So in the top bit, which is a module, that contains the top-level goal or claim. And for us, that top-level goal or claim is that the system will operate, well, actually, let me just check it. That for the intended purpose, the system will be ethically acceptable when used in the intended context. So that's the top-level claim, and everything beneath it contributes to justify that top-level claim. I've included here a four principles confidence argument. This would be necessary anyway, but it's particularly necessary in this case because in the field of academic medical ethics, the four medical ethics principles are actually quite contentious, and a lot of people don't think that they're the right way forward. Some argue that you can't reduce ethics to four principles. Others object that each ethical case or problem needs to be evaluated on a case-by-case basis. And in some ways, we bite the bullet on these criticisms in that I think that you can actually cover a remarkable number of concerns under these four ethical principles. And also, given that, say, this is a pre-deployment assurance argument that a developer would present or a provider would look at before deciding whether to deploy a system, it's not appropriate, really, to say you just got to do it on an individual case-by-case basis every time. So there's a pragmatic element to this as well. And another criticism of the four principles is that often the principles themselves are in trade-off or conflict. And that's actually something that we address in the justice argument, where we reconcile those trade-offs. And also, as I'll show in the next slide, there's quite a lot of room in this argument pattern for context sensitivity. So I'll go into the argument in a bit more detail, but just to sort of give you a sense of the logical flow. If we start, so if the top-level claim is to justify confidence that the system, when used as intended for the intended purpose, will be ethically acceptable, what we're doing is, in the beneficence argument, we're looking at all the benefits for all the beneficiaries, or all the anticipated benefits, and for which beneficiaries. And from that, we want to get a benefits matrix. In the non-maleficence argument, we're looking at all the risks, and for which risk bearers, and from that, we want to get a risk matrix. And then in the personal autonomy argument, we're looking at the possible constraints on the personal autonomy of the people involved, whether that's clinicians or patients or other people whose capacity to control things may be constrained. And that's yet another matrix. And then those three feed up into the justice argument, where we look at the distribution of those things and for which individuals, and decide on what the most equitable distribution would be, or if there are a few distributions that are equitable, and then those justify confidence in the top-level claim. Now, we don't treat transparency as a standalone principle, as it were. We don't treat it as an end in itself. It's a means to an end. So what we're really concerned with is what are the transparency requirements for each of those arguments. So this is opening the box on the very top level bit of the previous diagram. So, and this is the exact wording, for the intended purpose, the use of the system will be ethically acceptable within the intended context. And around that, the bits that look like, I guess they look like pills, these are the contextual artifacts. So what do I mean by ethically acceptable? I said that a few times. This is what we mean. This is our sort of working definition of what ethically acceptable might mean. That the design of the system, its outputs, its use, and its outcomes align with, and remain aligned with, people's reasonable expectations of fairness and respect for their welfare as autonomous individuals, as well as for the welfare of society and the environment in which they live. So that's very broad-ranging. It covers an awful lot. And the important thing there is this sort of focus on use and outcomes, because a system could be designed impeccably but be misused. So you need to have the question of use as well as design. And the thought is that this is a pre-deployment assurance case. Now we're starting to apply this to case studies to see whether this argument pattern is more than just an abstract idea that maybe is quite exciting to us and whether it might actually work. So one case study that we're working on is a conversational agent that's used for routine follow-up calls after elective surgery. And just to flesh out those TC1, 2, 3, 4, and 5, this is what it would look like for this particular agent. So the purpose is to reduce, the gap between supply and demand in the provision of healthcare, which works to the benefit of patients and clinicians alike. The usage TC3, is automated routine follow-up calls after surgery, elective surgery. The system is a conversational agent with machine learning components and natural language processing capability. The intended context is routine clinical conversations in predefined pathways, in secondary care, and it's post-operative. And another aspect of the intended context is that we don't live in a perfect world. So clinicians don't have a huge amount of time or resources to make these calls. Right. And this also shows, so the argument strategy, that's the parallelogram, is that we will be able to justify confidence in that top-level claim by showing enactment of the 4 principles. And that's what those 4 separate assurance arguments are. And the one that immediately feeds into it is the justice argument. That's where everything beneath it is resolved. So this is the beneficence argument. The main thing here is, what good does the system do? People often think ethics is about stopping bad stuff from happening, but ethics is about also promoting welfare and equality as well. So what benefit does the proposed system promise for individuals, society, and the environment? What we want to try and do is capture who precisely are the beneficiaries of this and what are the benefits that they get. How are these benefits realised, and are they monitored over time? So if you have a look at BC4 coming out of the argument strategy, that's where we'd end up with this benefit matrix, which is essentially, showing what I've just said, who the beneficiaries are and what the benefits are, how they're realised and how they're monitored over time. And that's for each group of beneficiaries. And the stuff below it is the information that populates that matrix. So for euphonia, for example, the example that we're looking at, the benefits for the patient might be things like timely contact, reassurance, consistent, comprehensive, continuous care. The benefits for the clinician would be the reduction of routine tasks, reduced burnout, the ability to concentrate on the things that they're best at, as well as oversight of patient outcomes. For the hospital, it would be workforce management, standardization of best practice, cost savings. These are just some examples. For society, benefits would include more capacity in the health service, better allocation of resources, and equitable access to care. And for the environment, given that this is a conversational agent that telephones you, reduce numbers of unnecessary car journeys. Now, the challenge is actually to really evidence and substantiate those benefits and to show how they're being realised and to monitor them over time. So now let's look at the non-maleficence argument. So this is about doing no unjustified harm. Now, this is the traditional arena of safety assurance. What we're interested in here is what risks precisely does the proposed system pose for individuals, society, or the environment? How are they mitigated and how are they monitored over time? But what's important here is that the risk of harm from a system is no longer just physical harm. There may be psychological harm. There may be the risks of invasions of privacy, risk of harm that specifically arises from discriminatory bias. There's risk of societal harm, such as to infrastructure or services, and risk of environmental harm. So for the case study that I just mentioned, there may be possible risks if, for example, patients who should be ruled in as being particularly at risk from a complication after surgery are in fact ruled out. There are the typical safety risks, but there may be also psychological risks that they feel particularly vulnerable or disadvantaged because a human being hasn't phoned them up to ask them how things are going after the surgery. There may be societal risks to do with a certain fragmentation of the healthcare system. So those are the sorts of things that we seek to capture in the risk matrix. And then finally, well, not finally actually, but from the three in that bottom row, the personal autonomy argument. So this is really important and can sometimes get a bit lost, actually, is how much meaningful control do people have over the systems, and do they have the right sort of control at the right time? It encompasses things like, as I said, meaningful control and informed consent. You don't have to try and read the little writing at the bottom, but I can just sort of run through you the summary version. So the first is about not undermining people's capacity, and that may not just be the patient, that may be the clinician as well, to form their own well-reasoned preferences and beliefs. So that means that the system doesn't unduly coerce the clinician into particular behaviours, and it doesn't also unduly coerce the patient into particular behaviours. The next one along, AG4, this is about whether the system identifies those features of the situation that the clinicians or the patients would want to be taken into consideration, whether it matches their intentions. AG5 is about informed consent. Is that something that people can give, or can trusted regulators give it on their behalf? And AG3, AG4, and AG5 they sort of coalesce under what I would call rational control, whereas AG6 is more about physical control. If the system's going wrong, can someone step in and stop it? Do they have the time, the knowledge, the experience, the actual physical capacity to do so? So those are the sorts of possible constraints on people's personal autonomy that we would want to address in the personal autonomy matrix. So as you can see, quite a lot of concerns that are raised across the AI ethics literature, if you're familiar with it, can be encapsulated in a single argument. I'm not saying it's easy to do, but it can be covered in a single structure. And then getting on to the justice argument, this is where we reconcile trade-offs. So say if there's a trade-off between there are fantastic benefits to one group of beneficiaries, but really quite troubling risks that can't be mitigated for another group of risk bearers, and then something about constraints on personal autonomy for a particular group. This is where we start to consider those and evaluate them side by side. The process for doing this, I'm talking to JG3 and JG4 here, is to eliminate unacceptable distributions of risk, of benefit, risk, and personal autonomy. So as an example of what an unacceptable distribution would be, there shouldn't be anybody who only bears risk from the system and gets no benefits, right? There should be no group that falls into that category. If someone isn't a beneficiary, then there should be some sort of compensation for them. So if it is actually true that somebody is put out of work by the deployment of a system, then there should be some sort of compensation for them. No one bears any risk without having any personal autonomy. It's not going to be fair if you're a risk bearer but you have no control over the situation. And no one's personal autonomy should be constrained to an intolerable degree. So if any of those things were the case, then that would count as an unacceptable distribution. And if that couldn't be, if none of those things could be dealt with, then you'd have to say that it would not be ethically acceptable to deploy the system. But if you can eliminate those problems, you've got the remaining distributions. And then these would be evaluated by a principle of justice first off. So now we're talking about JG4. And things that we'd look at here are, does it entrench any existing inequality? Or is anyone in a situation where risks exceed the benefits for them? And from those remaining distributions that now we can now say are equitable, we do a sort of like a next round of evaluation. Those values that are commensurable, where we've got situations where you can actually rank them, you can actually order them on some sort of single scale. You can just do that, or we can just do that. And for those situations where the values are incommensurable, which I think would be in the vast majority of cases, our approach is to employ a decision procedure, which actually comes from political philosophy, but you might be familiar with it because it comes into applied ethics quite a lot as well, called the reflective equilibrium. And what happens with a reflective equilibrium is essentially that a range of stakeholders, so in this case it would be clinical, patient representatives, technical, operational, would come together, look at the distributions, value and weigh their pros and cons, think about their individual beliefs and the importance, say, of what they think of societal benefits versus impact on patient autonomy, as well as any principles they adhere to, and collectively, through a process of mutual adjustment, try and find one or more than one where there's an acceptable coherence of opinion. And I was actually really interested to learn a bit more about the Delphi approach, because it seems as if there are lots of similarities between reflective equilibrium and Delphi. So once that's done, the hope is that there will be at least one distribution, probably more, that would be equitable. And having taken all of this information, you could say pre-deployment, if this is the case, then it would be ethically acceptable to deploy the system. I know I'm going over time, so I'm just going to skip over transparency because I've already said it. It's a means to an end, essentially. So what we need to understand is what are the transparency requirements, for example, to ensure that people can give informed consent in the personal autonomy argument, or to ensure that the risks are mitigated. And I'll stop here. This will be the final slide. But really, one of the main questions in ethics of AI and autonomous system is the deployment ethics question, right? When would the decision to deploy a system actually be justified? And it seems unlikely that that question is going to be answered by foresight alone. You know, we're going to need to learn from experience. But this seems to us a very promising way to take that first step. So we need to deploy ethically defensible systems and learn from experience. Okay, thank you. Oh, that's all the reasons why it's good.